Welcome to Educate, Inform, and Challenge. My name is Teresa McLennan. I'm Executive Director here at the Women and Children's Shelter of Barrie. We are so glad that you have joined us today on this journey. Before we begin, we do want to acknowledge and thank our Indigenous community. We thank you for culture, history, knowledge, awareness. We thank you for allowing us to be in this space and to have these conversations on these lands. We thank you. Today, I am thrilled to welcome my guest, Trish Brunelle, who is a physiotherapist, and she has areas of specialty that she's going to talk to us about. We are talking about areas today that I really don't know anything about. So just like so many of our viewers, I am an open book. I am just really eager to learn and to know more about the work that Trish does and just how we can integrate that into our health. And so welcome, Trish. It's going to be a great conversation. Would you like to just introduce yourself and tell anybody a little bit about yourself?
Sure. Thank you so much for that introduction. I'm a pelvic health physiotherapist. I've been a physiotherapist for 33 years, actually. And about 15 or 16 years ago, I started working in the area of pelvic health. And it's been a really big journey. 5 or so years ago, I opened a clinic with just me and one other physio. And now there are a whole bunch of us here, 9 people, 7 practitioners. So it's been really fun to see the awareness for pelvic health grow in the community and to see what we can do. And so we treat men, women, and children. Anybody with a pelvic floor for conditions like incontinence, prolapse, constipation, birth injuries, painful sex, vulvar pain. Those are the ones that come to mind quickly. Anyway, anything that sort of happens in that bottom neighborhood, we treat it from a physio standpoint. So it's super fun. And when we help people, I think we help people with things that can be sort of secretive sometimes, or people feel a lot of shame about. And so when they feel better, it's really rewarding. Yeah.
I think this is going to be fascinating. I think we're really just all going to be educated today. I don't believe that I ever really heard the term, pelvic floor health, pelvic health. And I agree with you. I feel like it's this secretive thing that really no one wanted to talk about for the longest time. In my own experience, of course, I know women in particular that have had surgeries for, let's say, incontinence issues that they run into after having children, different things, right? So can you break it down for us? What exactly does pelvic health mean?
Sure, I think I can do that. So when we look at the pelvis, we often think about the bony pelvis, but really what we're dealing with are the muscles that work with the pelvis. And so those muscles are really important. They help us hold pee and poo in, but they also help us let them out. They help us have babies if we're people who have babies. They give us sexual pleasure. They help support our organs, and they help with that venous return muscle pump with your blood coming back up from your feet and legs. So it's a really important group. And a lot of times we just think about it sort of in isolation, those things that I just talked about, but it also works in concert with the rest of your core because it is part of your deep core system. So it works with your deep abdominals, with your back muscles to hold you up and get you through your day. So we all have them. We just don't think about them until they're not working. And one of the ways they might not work, as you point out, is incontinence. So I think as people who have babies, we often grow up knowing that it's possible that we might leak a little bit of pee after we have a baby. And I would say that we set a pretty low bar for ourselves because I always say to people in my office, if you leaked a bit of poo, would that be okay? And most of the time people say, well, no, of course not. And I say, why would we accept the pee part? And it is true, you can have surgery, but if weakness was part of your problem, the surgery doesn't correct that. If it was a coordination issue in your system, surgery doesn't correct that. If it was because you were too tight, surgery doesn't correct that. So it might put a little Band-Aid on things, but what we will often see is people do well with their bladder slings or their postnatal surgeries for maybe 5 to 7 years, and then it slowly starts to creep back again. So we do the functional rehab part, same as we would do if you had a knee problem after a soccer game or something like that. So
it's terrific. I mean, this is just wonderful information. So we talked a little bit about that this is something that we have not really talked about openly, which I think is so important because there's so many of us that can experience these sorts of problems, right? And we may have in the past gone that medical route of having surgeries because it seemed like that was the only option for us. Let's say when you have a woman who comes in to see you, can you just talk to us about what she's feeling at that time? Like, do you have to work through with her embarrassment, difficulty talking about it? Like, we want to create an open forum today here to talk about it. What does that look like when a woman comes into you and she's having an issue, but she doesn't want to talk about it?
For sure. I think I have two camps of people who felt that way in the past and have sort of got past it, but we still do have people who come in very anxious and very apprehensive. They don't know what's going to happen. And so we spend about 20 minutes of the hour going through their history, finding out what is that person experiencing in their day that they're here and need help with. So I really want to know what they're experiencing. I try to make it really comfortable. I love to crack some jokes. If I need to share personal things so that people feel like we're on an even playing field, I'm happy to do that. And then I always will ask people what's their goal of the day. Because if they're really, really apprehensive about the exam, then we're not going to do it today. It doesn't matter to me. At the end, I can probably get enough information from talking to them to at least start them on a program. But if we can do an exam, then we do a little postural scan, see how their body moves in the world, have a look at back movements, spinal movements, because about 96% of people with low back pain also have pelvic floor dysfunction. So that came out of a really nice Canadian study. And so we take a peek at that because there is an interaction. And then if we can, if it's a person with a vagina, we do a vaginal exam and a rectal. And if it's a person with a penis, we'll do a rectal exam while looking at the pelvic floor muscles that I just showed you in different layers to see how they're functioning, how the coordination is, if there's any pain, say from where there was a tear, if there's any pain from any other trauma pieces, and then kind of put it all together at the end. And at the end, we sit back down and go through all the information we gathered. And what I always say to people is, when I do the first exam, I want to know if there's pain for sure. I might come back onto that spot so I can make sure I know what muscle it is. We'll go through the muscle layers with some diagrams. And I want people to know their body is giving me the information, and I'm just going to parrot it back so that they really understand at the end what's happening with them. And then we put the program together and send out a little email summary, and that's the first day. Yeah.
That's very thorough.
Yeah.
You know, because it sounds like the assessment piece of it is so important to try and figure out maybe root causes or that interconnection. And I think that's a great piece of information that you shared about relation to lower back pain and perhaps an issue with the pelvic area, right? So what would be the signs? Because you mentioned the back pain. What could be the signs that you actually may have an issue that needs to be worked out?
Right. So it could be back pain. So the kind of back pain where you might have had, you've seen another physio or a chiro and it's gotten 50% better, but not all of the way better. So we get a lot of referrals from other professionals of those sorts of people. Incontinence we talked about, so leaking pee or poo, and not just a little bit. If it's a couple of drops, that still says your body has reached its limit for that activity that you were doing. Pain with sex, pain with sitting. Sometimes people feel a discomfort or an irritation wearing clothing in the area of your pelvic floor. We talked about leaking already. A feeling of heaviness or openness through your vagina if you feel like it's open. If air comes out, so we call that queefing or little vaginal farts. Those are all signs of pelvic floor dysfunction. I think those are the main things. If you can't hold gas in. Yeah.
It's an extensive list. And when I think about all of the things that you're talking about, they seem like they could be very common things that people experience. And we've gone different routes to try and find solutions and answers and therapies and, to try and help that. And I am just really encouraged. And I think it is wonderful that there is this new avenue to go of exploring that perhaps could be less intrusive in terms of fixing that problem. And so we're going to dive more into this conversation. We do hope our viewers will stay with us because this is important for our health, for us to have open dialogue and conversation about our bodies. We all have these parts, and we can have these parts that aren't working the way that they need to sometimes. And knowing about it, knowing when we can recognize something's not working right, and then knowing where do I get some help or have an assessment to help me with it. That's our conversation today. We really appreciate the openness. We're going to be talking bluntly about these things because we have to. And we just really encourage our viewers to stay with us. We're going to take a short commercial break and we will be right back.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome back to Educate, Inform, and Challenge. We're having a great open discussion today with Trish Brunelle, who is a physiotherapist who really is working in the area of pelvic health. And so we hope that this information is going to be educational to you and really just maybe guide you in seeking out some support and help for an issue that you might be having with your own pelvic floor health. And so that is what we're talking about today. So Trish, I'm just going to pick back up our conversation. Why is it important for women to seek out, advice and support about their pelvic health and receive the right treatment?
Oh, well, that's a big question. I think it's important because there's a variety of reasons. Number one, I think that a family is only as healthy as its weakest or sickest member. And so if somebody's really struggling in the area of pelvic health, be it simple incontinence, be it maybe an inability to have sex due to pain, that can really impact the relationships in a family. So while it's important for this individual as well, I think it really is a whole family problem. And certainly I've seen that when I've had people come in with their partners. So if we just looked at the painful sex piece, I firmly believe that both partners should be comfortable and have pleasure during sex. If only one person's having pleasure, I have a real problem with that. So we talk a lot about that in here. And I think that being able to help empower people to state what's happening with them, to themselves, their partner, and their care providers is really important. So that's just one piece of why we do what we do here, I think. So as an example, we talked a little bit earlier about painful sex. We've got a lot of tools we work with. So we've got this little gadget. It's called the O-Nut. And I like to say I invented it because I sort of did, but I never finished inventing it. But assuming this is somebody's penis, if somebody gets pain with depth of penetration, then we can use the O-Nut to restrict the penetration. So it's very stretchy. So it stretches, and we would put it over the partner's penis. so that only part of the penis could enter. And so then if depth is the problem, we have a way to deal with it. After a while, we can, as she's able to accommodate, as the person's able to accommodate the partner, we can take one off, we can take the next one off, and the goal is eventually we don't need it. So we can work with something like this. We can work with something like this, which is a set of dilators, and they go in from, so they work on girth from smallest to biggest. And we have a series of exercises we teach people how to do here in the clinic. Sometimes people bring their dilators in and we work here with them in the clinic. So that's just the one piece around painful sex. And it's not that uncommon. It's about 10 to 15% of the population. Some of it's primary, meaning they've never been able to have something inserted vaginally. And for some people, it is secondary. It might be after they've had a baby, after they've had a surgery, after they had an accident, say I had somebody fall on a bike seat hard, so something like that. And so then we can work with dilators or something like the O-Nut. So there's some really cool products we have in the clinic for that. So that's one part. And then we talked a little bit about, we didn't talk about birth prep, I realized, which is actually a big group in our clinic. So we see a lot of people who've had injuries during birth. Very common. People know that they might have a risk of tearing. I also am a birth doula because it seemed like a natural fit to go to birth to see if I could help people avoid that sort of thing. I haven't gone to as many since the pandemic started, but certainly what I do is I have people bring their partners in and I give them a little mini doula course. How do we prep a woman to have a baby? So we have a little vagina here, and we can show them how to do the perineal massage. So they would come in and do the massage for their partner. Then we teach them about birthing positions, looking at where the evidence says we should be birthing. And so, fun fact, most people deliver babies from their backs in some sort of position, whether they're semi-reclined or fully reclined. But the least amount of perineal damage, the least amount of trauma to this part of a person's body happens during side-lying deliveries. And only 3% of Canadian women at last survey deliver on their sides. I would like somebody to explain this to me. So here in the clinic, I try and tell people this is what we know. Certainly try side lying if it's comfortable and it feels right and you can feel that that's being effective. You know, lobby for yourself to stay there. If there's a medical reason you can't be there, they can't monitor the baby's not doing well there, something else is happening, of course, you have to take your care provider's knowledge in hand. But if possible, and if side-lying feels great, it may be the place where you come out as intact as possible. So it's that sort of information that we like to go through every day and teach people and help them in a proactive way, as well as not just that sort of, what can we do to help something after it's happened? So I don't know if that helps.
I think it does. I think it's great information that just most people don't talk about or that they know. And I know that there's so much more. So I'd like to ask you, are there certain things that people will come to you for help with that if they had left untreated could be a very, very serious, have complications?
I'm going to say sort of. I think not serious in a life-threatening way. So we really are very careful with language here in the clinic. One of the things we don't like to do is sort of make people's nervous systems already more hyped up than they are at the moment. So there are certainly things that people deal with that are tough. So things like prolapse. And prolapse is when your organs start to descend towards your vaginal opening and sometimes beyond the opening. And for a lot of people, that can be very traumatic as even a thought process, but certainly we find people first notice it themselves. Often they'll be having a shower and they go to wipe and realize what is there that wasn't there before. And that can be really scary for people. So if you've never heard of prolapse before, I have a number of people who've gone to the emergency room thinking they have a tumor or something terrible has happened. So that is one thing I think that if left unchecked can lead to urinary retention, issues with constipation, issues with sort of obstructed sexual contact, more UTIs, that sort of thing. So it can be pretty tough. But we.
And so, Trish, when you're talking about prolapse bladder,
yeah,
you're talking that it has actually come outside of the body.
Sometimes. So there are grades of prolapse. So the 0 would be none. Grade 1s and 2s are the most common. About 80% of people have a grade 1 or a 2. And a grade 1 is when there's the bladder has started to come into the vaginal cavity, but it hasn't descended very much yet. Grade 2 is when it is within 1 centimeter inside the vaginal opening to 1 centimeter outside. So that 2 centimeter range is a grade 2. And so the vast majority of people we end up here within the clinic have a grade 1 and a grade 2. And the research has shown that really those grades are best managed with physiotherapy. Grade 3 and 4, people who have that, the bladder will be much further out, so more than a centimeter out. So it looks like a little ball hanging out of the vagina. And grade 3s, I find, will still kind of go in and out. If you lay down, they pop back in, and they might come back out later when you're up doing things. Grade 4s typically stay out all the time. When you're looking at it, though, you're not looking at the bladder directly. You're sort of looking at, I didn't bring a prop for this, but imagine that this is the vaginal wall, and here's the bladder. You're looking at the bladder sort of pushing into the vaginal wall. So I always say it's as if when your kids are small and they hide behind your curtains and they push their head into it, and the curtain moves, the vaginal wall would be the curtain and their head would be the bladder, if that makes sense.
Yeah.
So we don't look at the bladder directly, which is a little bit less scary, thank goodness. But you can prolapse your bladder, your rectum in 2 ways, your loops of your small intestine, your uterus, your sigmoid colon, and your vaginal cuff. So if you've had a hysterectomy, your vagina itself can kind of come out. So it can be very alarming for people and very distressing, but it's also very uncomfortable to have this feeling of sensation of heaviness and pressure, or a ball sensation sitting there. So whenever we can help, we do. And there's lots of things we can help with. So for example, we have these guys. I'm going to hold up a couple. They are pessaries, 1, 2 more. And they help hold prolapse up. So so I'll just use this one. 80% of people get one of these. You fold it, it gets inserted and it opens, and your organs sit on top of it. So it can provide support for your prolapse so you can get your day done. And traditionally we've used these in mostly the over 75 crowd. But I would say that somebody who's got 3 kids and is chasing them, and a dog and a house to take care of, needs a pessary way more than maybe I would at 75, when I have the ability to adjust my life in a better way. So we do have a lot of young women wearing these now, and allows them to get back to their activities and things like that. And I think that when we support your organs in a good place, and then have you do either your Kegel exercises or whatever other exercises we get you to do, we're getting you to do it with your organs where they're supposed to be. So we're reinforcing to your body, this is where Teresa lives, up here and not out here. So I think it's a really important tool that's been very underused. So anyway.
It's great information, Trish, and I am learning so much, as I know that the folks who are watching today are as well. And when you're talking about your therapies that you offer, I mean, traditionally, would these have been things that would have been immediately directed towards surgery in the past?
Absolutely. So still, I'm in a lot of online groups, and I'm a moderator in one group that's quite big, and a lot of our women are from the US. And so a lot of them do have surgery really early on, whereas in Canada, we don't do that as much, which I think is a really good opportunity for us to work with people. I mean, economically much cheaper than surgery. Downtime, there is none, right? Because a prolapse surgery would take a good 6 to 8 weeks of recovery. So I think, yes, we can catch people early and really make a difference in how they function in the world.
And so are you seeing good outcomes in your approach to offering this kind of physiotherapy? Like, are you seeing good success?
Absolutely. Yeah, we're quite happy. I think the average number of visits is sort of 6 to 8 visits, although I've certainly had people come and be gone in less. And I think just one example of a real success story I had last year that I'm really happy to be part of was a woman who'd basically spent half of her life laying on the couch with endometriosis, which is something we haven't talked about. And that's a painful abdominal and pelvic floor condition. I only saw her 4 times, and she said, I've got it from here. I have very little pain. She said, I've re-registered for my last few university courses that I have to do, and I'm going to get these done and get a job and get going. And I was like, hallelujah. So that was an exceptional moment for sure, but we certainly have people who do much better afterwards. So.
I think it is amazing. And so I'd like to share your contact information, how anyone who's listening today can reach out to you. So how do folks find you, Trish?
Sure. We're at Get Moving Physio, which is at 136 Bradford Street. And we have 4 pelvic floor therapists here and a social worker and 2 massage therapists and a chiropractor. But I also like to say that there are other clinics in town that do this too. So if we're busy, and we are, thankfully, because it means people are hearing about us, you can go to the College of Physiotherapists of Ontario and type in that you want to find a pelvic floor physiotherapist, and you will come up with some as well.
Yeah. And so if there is someone listening today, a man or a woman who thinks, I think I might have something that I'd like to talk to Trish about, and they're scared, what would you say to them? How do you encourage them?
Well, I always say, we've learned hard things our whole lives. And my job is to help you optimize whatever it is you're dealing with. I always say to people, encourage them to do a chat, and people can send me an email at getmovingphysio@gmail.com, and I'm happy to advise them there until they're comfortable.
Yeah. And I think that those are words of wisdom. And so we just want to thank our community for being with us today and learning about this great support that is in the community. Trish, thank you so much for your openness and your sharing. I love that we didn't need to sugarcoat any of our words today. We are talking about our bodies. We know the parts that we have for our bodies, and we need to own it, and we need to say what they are. And I think that was really great. And I think that is good for our viewers to see in Trish in particular, because you know that she is going to be talking to you in a way that is respectful of your body and listening to you, listening to your body, and wanting to provide the best support possible. So if you are someone listening today and you just really want to get some answers to maybe a lingering thing that might have been with you for a long time or something new, please reach out to Trish and, seek her advice and support, and she will guide you where it is that you need to be. Thank you so much again for being with us. We ask you all, take good care, and we will see you next time. Bye-bye.